propose to address the issue of school funding in Ohio?
I thought that was the question, but I must have missed the proposal to address it from Mr. McGregor. One of the things we have to do is we have to step back and look at the different sources of revenue that the state has and look at it from a holistic perspective. Now, let me just give you an example real quickly. 46% of the businesses doing business in the state of Ohio, not just Ohio corporations, but all of them doing business here, paid less than $50 in income tax. 35% of the businesses doing business in our state paid less than $2,000 in income taxes. Now, I don't know about you, but I know I paid more than that in income taxes. So maybe we need to look at that tax code. Maybe we have traded off the fairness to the middle class, who, by the way, didn't do well under the 21% tax cut that was passed this past year by that General Assembly. That's one source. Maybe we need to look to how we're spending it on charter schools, 78% of whom are below the academic watch mark. We spent $487 million of our education budget on that last year. And by the way, Jim, in Vinton County, public schools are using plastic placemats to patch the roof because there aren't enough dollars for them. Thanks.
Thank you. Beverly, you get the next question.
Oh, okay.
Ohio has over 1 million people without health insurance and without ready access to health care services. How would you address the issue of providing health care coverage for uninsured Ohioans?
Now, you've really hit on a passion of mine, and that's access to health care. As I was saying earlier, I lived the nightmare, and I still live it to a certain degree. I am here today because I had access to excellent health care. I'm a productive member of society because I had access to excellent health care. Otherwise, I would either be dead or I would be a drain on the economy. I was supposed to have been permanently and totally disabled indefinitely. Access to health care not only helps those who are uninsured, it also makes them more employable. So they add back to the economy. We're the only industrialized country that does not guarantee access to health care. Now, there's a number of ways we might go about it. I've been following the Massachusetts plan to see how that works, their experiment in providing access to health care. We might have the state administer a plan and have the different healthcare companies bid for contracts. The possibilities are only as limited as the vision and the commitment that we have.